Now let's move to today's perspective, and today marks the International Day for Access to Safe and Legal Abortion. Now it's a day which has its origins in Latin America and the Caribbean, but nowadays the Women's Global Network for Reproductive Rights, which is behind the day, says 85 countries around the world are involved. Now this year, perhaps the day notable, for example, in the US, where the Roe versus Wade case was overturned, ending protection of abortion rights by the US Constitution. Today, though, in Perspective, we're going to talk more about the situation in Africa, notably Kenya. And joining us from there is Martin Onyango, who is Associate Director of Legal Strategies for Africa from the Centre for Reproductive Rights. Thanks very much for joining us here on the programme. I want to start off talking a little bit more generally. We'll come to talk about Kenya in a moment. But why do you think it's so important for women to have access to abortion?
Abortion is a fundamental right, part of access to healthcare, and women and girls have a right to healthcare of the highest attainable standard, whenever they need it, with no restriction, and getting quality wherever they are, productive healthcare, including access to safe abortion.
OK, we're having trouble with the line. I'll ask you one more question. Hopefully it'll come back and work for us. In Kenya, the right to have access to abortion is just when pregnancy threatens the life and health of the pregnant person. It was guaranteed 10 years ago, but there have been difficulties, haven't there, in ensuring that right is still there. What have you been able to do to try and help people ensure that they do at least have that minimal right of when there is a threat to the woman?
Thank you very much. In Kenya, women have access to abortion care when the health or the life is threatened or in emergency situation, or when allowed by any other written law. However, the women and girls in Kenya have faced a myriad of challenges in accessing access to safe abortion, including the withdrawal of technical to provide safe abortion, include regressive efforts by the government to take away policy, move back to a restrictive access, police harassment and intimidation of providers and women and girls seeking access to abortion care. What we have the center as the areas where we work is, one, to seek the full enforcement of the constitutional provision. We have challenged the withdrawal of the guidelines, and the courts have actually reinstated the technical guidelines that were withdrawn. We have gone to court to challenge arrest and prosecution of providers and women seeking care, and the courts have pronounced themselves that, one, denying women access to abortion care within the law is a violation of their fundamental rights and freedoms, and that abortion care is a fundamental right within the Constitution of Kenya, that it is cruel, inhuman, and degrading to subject a woman to forced medical examination for purposes of prosecution. And the courts have actually barred the police from prosecuting providers and women who provide and seek abortion care within the law in the Republic of Kenya. And that is what we continue to do as the Centre for Reproductive Rights.
So it sounds like you've had some successes, but presumably you would argue that actually that right should be there for everybody, whether there's a threat to the mother or not.
Thank you. At the moment, the limitation to access to abortion care in Kenya is governed by the Constitution. So currently, the argument and the focus is to ensure that all women and girls can access safe and legal abortion within the confines of the Constitution. While the Constitution has clarified those confines, it has not been a walk in the park. we still have high incidence of unsafe abortions happening because the government has created a restrictive environment contrary to what the Constitution has provided. The government has not allowed providers a free hand to offer professional medical care in the nature of provision of safe abortion as required by the law. And those are the challenges that we are dealing with at the moment. When we will be at the point of full access within the Constitution, uninhibited access within the Constitution, then we can talk about what further progress to realize access to safe abortion in other circumstances beyond what the Constitution dictates. Currently, we are fighting for full enforcement of the Constitution of Kenya when it allows access to safe and legal abortion.
And just finally, presumably those restrictive rights, as you put it, I mean, that does lead, doesn't it, to a lot of women going for unsafe abortions. I mean, there's one figure I saw looking into this yesterday. Some NGOs say 97% of abortions, this is across the whole of Africa, are unsafe at the moment.
That is entirely true, that when you create it does that abortions are not happening. They are happening, however, they are happening in unsafe conditions. They are happening in environments where the government has no control over who provides them or the quality of care they provide. The net effect is that we have seen a rise in mortalities and morbidities from unsafe abortion. And that is the challenge, that thousands and thousands of women and girls are dying from seeking unsafe services, while the law has created a framework for providing safe services. Restriction in the nature of arrest, prosecution, administrative restrictions, opposition, stigma, those limit access to care from trained health providers who provide care in safe environments. And this is what we must fight, that we need to create an environment where every woman, every girl who is in need of abortion care will go to a health facility where the quality, the standard of care can be guaranteed, and they will get the care they need without risking their health, without risking their life, and without exposing themselves to any prosecution, intimidation, or harassment by anyone.
Good to talk to you on the programme today. Thank you very much for joining us. It's Martin Onyango. He's Associate Director for Legal Strategies for Africa from the Centre for Reproductive Rights. Sorry about the quality of the line there, but I think you managed to get most of what he was saying there. Martin Onyango, thanks.